Welcome to our webinar. Bienvenidos. In the name of the National Latino Behavioral Health Association and the National Hispanic and Latino Prevention Technology Transfer Center, we welcome you to today's webinar titled Hispanic Stress and Resilience During the Holidays. My name is Dolca Michelle Zelaya. I am the program coordinator for the National Hispanic and Latino Prevention Technology Transfer Center. I will be your host for today's webinar. Before I introduce you to today's guest presenter, here are some brief instructions about today's presentation. The webinar will be recorded and archived for future playback. It will also be recorded in Spanish and Portuguese and posted on our website. A copy of today's presentation will also be available after the webinar. The lines will be muted throughout the presentation so as to minimize background noise. When we get to the Q&A portion of our webinar, you will have the opportunity to ask questions to the presenter by clicking the Q&A box. We'll be also asking you to fill out a brief survey at the end of this webinar. This satisfaction evaluation is important to the work we do and provide us with the opportunity to improve our training efforts. Although we don't secure continuing education credit for this event, we plan to do for future events. Instructions on how to obtain a certificate of completion will be emailed to you after the event ends. So let's begin. NALBA, let's start by introducing the National Latino Behavioral Health Association, NALBA. It's a nonprofit organization located in New Mexico. The mission and goal of the National Latino Behavioral Health Association is to influence national behavioral health policy, eliminate disparities in fundings and access to services, and improve the quality of service and treatment outcomes for Latino populations. NALBA was established to fulfill a national voice for Latino populations in the behavioral health arena and to bring attention to the great disparities that exist in areas of utilization, practice-based research, and trained personnel. Our executive director is Mr. Fred Sandoval. NALBA's priorities is to provide national leadership on mental health and substance abuse concerns of the Latino community. NALBA's policies priorities are targeted capacity expansion of mental health services for Latinos, the Latino behavioral health evidence-based practices, legislation to increase the number of counselors, therapists, and other behavioral health practitioners, funding for co-occurring disorders of alcohol and substance abuse, opioid crisis in the Latino community, and suicide prevention. Now, allow me to introduce you to our Prevention Technology Transfer Center. Our PTTC is part of the PTTC network, a multidisciplinary resource for professionals in the prevention field. The PTTC network was established in 2018 by the Substance Abuse and Mental Health Service Administration, SAMHSA. The PTTC network is comprised of 10 domestic regional centers, 2 national focus area centers, and a network coordinating office. The PTTC together, the network serves the 50 states, the District of Columbia, Puerto Rico, the U.S. Virgin Islands, and the Pacific Islands of Guam, America Samoa, Palau, the Marshall Islands, Micronesia, and the Mariana Islands. Our center has a national focus for Hispanic and Latino communities and the workforce that provides services to these communities. Our PTTC is staffed by Dr. Pierluigi Mancini, our project director. I serve as a project coordinator, and Priscilla Yamasi is our executive administrative assistant. Now it's time and an honor to present our esteemed presenter for today, Dr. Richard Cervantes. Dr. Cervantes is a research director of Behavioral Assessment, Inc. He served as the lead evaluator for SAMHSA National Hispanic and Latino Addiction and Prevention Technology Transfer Centers. Dr. Cervantes was a research psychologist at the University of California, Los Angeles, a Spanish-speaking mental health research center, and held a full-time faculty appointment in the University of Southern California, School of Medicine, Department of Psychiatry and the Behavioral Science. Dr. Cervantes was the principal investigator for the National Institute of Health funded study development of the Hispanic Stress Inventory tool, and the principal investigator of the recently completed prevention study Familia Adelante, a multi-risk prevention program for Hispanic youth. Dr. Cervantes is also a leader in evaluation science with special expertise in cultural competence and cross-cultural instrument development. He has published extensively in peer-reviewed journals, books, and special reports. Dr. Cervantes received his PhD in psychology from Oklahoma State University. Dr. Cervantes, we are very happy to have you with us this afternoon. Welcome. Thank you for accepting our invitation. And please, you can proceed with your presentation.
Thank you very much. And on behalf of SAMHSA, the National Hispanic Latino Prevention Technology Transfer Center, and Behavioral Assessment Incorporated, welcome to today's presentation, Hispanic Stress and Resilience During the Holidays. What I'd like to do this afternoon or this morning, depending on where you're at, in which part of the country you're at, is just to provide you with a general overview of what we know about stress, what we know about Hispanics and stress, and resilience. I'd like to then also provide you with some information about ways to help not only yourselves in self-care, but also ways to think about helping your clients, consumers, and others who utilize your services out in your various communities during the holidays. And goes without saying that we're experiencing some very unusual times, unprecedented times. And so we'll be talking about these things over the next hour or so. If you have any questions, please feel free to post those in the chat area. Okay, let's go to the next slide. So let's try to get some common language about what is stress. So I'm going to distinguish between two terms that are commonly used, stressors and stress. So stressors are demands that are made by the environment that upset our balance, or what we call homeostasis, affecting physical and psychological well-being and requiring some type of action on our part or our family to restore equilibrium. Stress is the perception that these demands, that the stressors or that a situation exceeds the psychological, social, or material resources for coping. Stress contributes to illness through direct physiological effects or through indirect effects via maladaptive behaviors such as smoking, poor eating habits, and even substance abuse. And that's why understanding stress, stressors, and the stress coping framework is so important for providers from a prevention and early intervention perspective. Stress does not affect all people equally. Interestingly, there have been studies that show differences in how people communicate and experience stress within different cultural groups. And I would refer you and can provide you with this citation from Pine, Padilla, and Maldonado that look at Mexican American, Native American, and European Americans in terms of what they defined as most stressful. And as an example, for Native Americans, the most stressful event rated in that study was taking a bank mortgage out to purchase a home. The most stressful event for American or European Americans was the death of a spouse. And the most stressful event for Hispanic, Latino, Mexican Americans was the son or daughter leaving home. So you can see that how we perceive stress is really a function of our cultural upbringing and our cultural lens. Um, just some early, I thought it would be interesting to think back to, or to go back to some of the earlier conceptualizations of stress. So Dr. Walter B. Cannon was really the first to describe what we call the fight or flight reaction to stress. And some of these conceptualizations of health, stress, coping, and resilience are derived from many disciplines, with some of the earliest work having been done by scientists in the field of biology and psychophysiology. Diverse health and behavioral science disciplines now, including epidemiology, personality psychology, cognitive, clinical, and social psychology, as well as sociology and medicine, have contributed greatly to our understanding now of stress and coping. From a physiological perspective, it's important to know that when we perceive something as being stressful, as being a threat, according to Hans Selye, the father of modern stress research, he hypothesized that all living organisms have what we call non-specific changes in response to stressors. And he labeled these changes the three-stage general adaptation syndrome. So many of you that have taken psychology classes will remember the general adaptation syndrome, where we have initially, when we're confronted with an event or some type of threat, uh, we have what is called an alarm reaction. Then we go through a period or a stage of resistance, trying to fight off or ward off the stress. And then finally, if we cannot manage or cope with the stress, we end up in a phase of what Celia called exhaustion. So each stage evokes both physiological, that's really important, and a behavioral response. With curative measures, physical and or psychological deterioration can occur. Without curative measures, that's to say. So unless we kind of learn how to cope with stress, kind of learn how to manage stress, how to mobilize our own personal or family or community resources, without implementing those kinds of measures over time, stress will affect us negatively. So currently, and I don't want to go too far into a biology about stress, but there's a lot of new findings in terms of what stress does to our body at the cellular level. So we all know that the body can constantly reproducing healthy cells, and this is a process is directed by our DNA and our genetic code that's found in our chromosomes, right? What happens with stress, in that second bullet, you can see something called allostatic load, which is a new concept. You can certainly Google it and learn more about it. But that's the wear and tear of the body at the cellular level in response to chronic stress over time. And it's a predictor of poor health outcomes, actually including most all causes of mortality. So the body has a physiological response to stress that we now know about from biophysiological studies. During the acute stress phase, there's an activation of stress hormones in our body, as well as anti-inflammatory cytokines. So you've all heard about cortisol. Um, that's produced by in the brain, the pituitary response, And that cortisol, in, it really helps us to begin to prepare to fight. Remember, we talked about the fight or flight response, the general adaptation syndrome. So the body prepares itself uh, when confronted with these acute stressors. Secondarily, we have effects on the metabolic, cardiovascular, and immune systems. So once these hormones are produced, then it affects our heart rate, affects our blood pressure, and things of that nature, and ultimately can even affect our immune system. And then the tertiary outcomes over the long haul, and when we talk about allostatic load, the wear and tear on the body, we can actually see cognitive decline, cellular aging, telomere atrophy, that's the length of our chromosomes actually begin to shorten, and diseases can occur such as diabetes and cardiovascular disease, as well as I can add behavioral health issues. So over time, and some colleagues have written a lot about the syndemics that occur, which is sort of a complex of multiple behavioral health problems when confronted with allostatic load. So not to confuse anybody or to go into a lot more detail, other than to say stress is real. It has an effect on our body. It has a wear and tear effect on us at the cellular level, and it's something that we need to try to understand and help reduce. What about acculturation and stress? Let's talk about acculturation. In a very simple way, acculturation um, is when we try to fit into the mainstream. And we know that American culture can produce stressful life events that are associated with poor mental health, substance abuse, and alcohol use. So, for example, and I'll go into more detail here, but among Hispanic youth, acculturation gaps within the family have thought to be a key in understanding mental health, behavioral problems, and suicidality. Much of our previous NIH supported work indicates that acculturative stress or acculturative stressors are related to poor mental health. Acculturation stress can reflect cultural, familial, and community level conflict following immigration and can continue into later generations. I know many of you listening in on the webinar today are US born. Some of you probably have whose families have been here for multiple generations. There's still a degree of acculturation that occurs. We're constantly trying to fit in to mainstream culture. Um, Acculturation gaps within the family have also been implicated in increased depression among youth, increased drug use, and binge alcohol use. So acculturation gaps, when their children or youth have acculturated more rapidly, and I point to some of the work by my colleague Daniel Santisteban and his group at the University of Miami. They've looked at substance abusing adolescents and have found that acculturation gaps is a really important thing when kids are acculturating at a much more rapid pace than their parents. In the face of acculturation stressors, Hispanic families show a number of resiliency factors that can moderate or that moderates the effect of stress. This is very, very important from a prevention and early intervention perspective. When we work with children and work with families, if we can begin to help them mobilize, that is to call forth, mobilize, to to pull on cultural resources and cultural resiliency, that's going to be really important in terms of buffering the effects of stress. And I'll talk about that shortly. So I wanted to share with you some of the research on cultural stress and risk factors for Hispanic adults. And this is based on some studies that were conducted in developing what we call the Hispanic Stress Inventory. This is a test that we can give in clinical or counseling settings or in community settings to kind of assess levels of stress. But some of the things that we found in these studies are these big domains or big these areas of stress. And so, for example, among adults, family and cultural conflict has been found to be very prominent in adults, both immigrant and non-immigrant populations. Secondly, discrimination stress has been found to be very crucial and help in sort of identifying potential areas that promote or that result in depression and anxiety. Health-related stress. This is really important for Hispanics. Concerns about family health, about taking care of the elderly, about not being able to pay for medical expenses or not having health care insurance. So health-related stress is very important for our population. Economic and occupational stress has been found to be important. Things like the importance of getting ahead in a job, having to compete with other people, even being discriminated against in the workplace, have been found to be really important in understanding mental health. Immigration stress goes without saying. Um, Individuals who have issues around legal status, around family separation, language related stress subsequent to immigration. We've also found that pre-migration stress is a robust or powerful predictor of current mental health, particularly, as I said, in immigrant samples, immigrant populations. Remember that when our clients come here and we're working with immigrant populations, we need to understand the traumas and past experiences that they've had prior to immigration that may still be affecting mental health and may in fact prompt PTSD kinds of symptoms. So a very important area of stress. Parental stress, that goes without saying, is also very important and a very crucial area of stress for our Hispanic parents. Thinking that children, for example, are using illegal drugs or not understanding how to negotiate our children's school system, particularly now during COVID-19, parental stress levels have gone up tremendously for our Hispanic parents. And then another area that we found to be very important in terms of predicting mental health are cultural differences within the marriage. Um, as an example, couples or partners who disagreed about whether or not to go back to the home country or not, or how to raise children, how traditional versus Americanized children should be raised. So these are very important as well. So similarly similar to the adult stress studies that we've conducted, we've also looked at stress in youth. And through an NIMH funded study, we were able to identify 8 areas of acculturation or cultural stress for our youth. And these are all national samples. By the way, I can just say these data are based on samples collected from the East Coast, West Coast, down on the US-Mexico border. But for kids also, family economic stress is really, really important. Children suffer when their parents are unable to pay bills. Acculturation gap stress, I mentioned this earlier. When children and adolescents are acculturating or becoming Americanized at a much faster rate than their parents, it constitutes an important area of stress. Cultural conflict within the school has been identified as really important. We had kids or have kids that tell us that their teachers think they're cheating when they speak Spanish. Um, Schools that do not want to promote cultural holidays or customs. We see this a lot in this particular area of stress. Children also report immigration stress regarding their own families, discrimination stress, that includes discrimination in the community as well as in the school setting. Children and youth also talk to us about family-related immigration stress. So even though a child, and you'll see in a subsequent slide, that the majority of Hispanic Latino kids are actually born in the US, but they still have family that are struggling with immigration-related stress. Community and gang violence related stress is very important. Youth have told us in multiple studies about this kind of stress, that it is real. It is something that prevention specialists need to attend to and be aware of, that some of our neighborhoods are not the safest, and we need to prepare kids and families for dealing with that kind of stress. And then finally, children and adolescents tell us that it's very stressful when there are family drug or legal issues. When a parent, a tia, tío, a brother, sister, when they have drug-related problems and they're involved legally, it's very stressful for our children. All of these 8 areas have been found to predict poor mental health. So the higher the stress in our children, the more likely it is that these kids are going to experience some type of mental health issues. And we have other studies that kind of have gone into detail on which types of stressors are more important in terms of anxiety, depression, and even self-harm behavior. So as prevention specialists, please pay attention to these kinds of risk factors, both in adults and adolescents. Well, I wasn't going to be able to talk about stress today without at least getting into issues around COVID-19. And we're all acutely aware of the kinds of stressors that we all experience, but particularly Latinos in some of the poorer communities that while they may not be as privileged, they're still experiencing, some people experiencing really high levels of stress due to COVID. Latinos are 8 times more likely to be tested positive for COVID-19, 6 times more likely to become hospitalized, and twice as likely to die from COVID-19. This is based on the recent CDC data coming out of CDC from 2020. So very sad what we're seeing in some of our communities. This is a little bit of a busy slide, but Hispanics, as I mentioned, are adults are 3 times more likely to become infected and 5 times more likely to be hospitalized than non-Hispanic whites. And you can see the graphs on the right-hand side. A strong majority of Latinos say the worst is yet to come in terms of the corona outbreak. I won't go through all of these bullets, but we'll share this slide deck with you. But as I've mentioned, higher rates of COVID-19 exist in our community. Unfortunately, a large proportion of our population is not insured, and they're not sure where to go for testing or preventive health care. A lot of Latinos work in these high risk occupations, including service industry, restaurants, construction. There was a recent, actually yesterday, a report came out of the Los Angeles County Department of Public Health showing that construction workers, the rates of COVID-19 have skyrocketed among construction workers, of which are predominantly made up of Hispanic Latino adults. In terms of housing and rent, coronavirus exacerbates housing instability, with 57% of Hispanics spending nearly a third of their income on rent. Food insecurity, 16% of Hispanics suffer from food insecurity, and cannot stock up on food. Hispanic unemployment rate has spiked during COVID-19, with women seeing a bigger increase than men. And of course, behavioral health issues, grief, depression, insomnia, loss of normalcy, and I can say increased substance abuse and alcohol use is prevalent now in our community. For preventionists, as I said, when you take the stressors that we looked at on the two previous slides, and you combine them with the cumulative effect of COVID-19 stress, it's a lot for our population. And so our population really needs to be sort of heard, to be understood, and we need to provide the kinds of resources that our communities need for coping effectively with the cumulative effect of acculturation stress and now COVID-19 stress. In terms of COVID-19 and its impact on our children, 1 in 4 youth in the US are Hispanic. The vast majority of those children are born in the US. 1 in 4 children, Hispanic children, do live in poverty. And interestingly or importantly, 1 in 4 Hispanic children has a parent who is an unauthorized immigrant. That's unauthorized or has issues with their legal status. Very important because even though children may, as you can see, the majority of children are born here, these families in the community are still dealing with issues around immigration and immigration stress. So really important as prevention workers and early interventionists to understand that even though you may be doing school-based prevention work, to understand that immigration and the stress associated with immigration may be impacting those children. Hispanic families have been especially hit hard by the COVID-19, as we mentioned. However, economic hardship has been a reality for many Latino children since before COVID-19. That's, as I mentioned, that cumulative impact of stress. And approximately 1/4 of our children live below the poverty level. In terms of children's mental health, I thought this was a really interesting statistic that compared to 2019, the proportion of mental health related visits for children, these are emergency department visits for children ages 5 to 11 and 12 to 17, has increased by 24% for the younger group and 31% for the older group. So monitoring these indicators of children's mental health, and by the way, these are all for a mental health episode. These aren't just for health related, but these are specific to mental health issues. Monitoring indicators of children's mental health, promoting coping and resilience, and expanding access to services to support children's mental health are critical during the COVID-19 pandemic. Children, in general, children are suffering with COVID-19. They're suffering with the isolation from their peers. They're suffering from being at home and in front of a computer and trying to learn, spending a lot of time in front of the computer and really relying on good internet access. It's hard to believe now that a child's education is dependent on whether or not they have a stable internet access, but that's where we're at now. And as you can see, a lot of children nationally are suffering with this, including our kids, Hispanic and Latino kids. So keep that in mind, that promoting coping and resiliency is very important, especially during this time, and equally important during the holidays, and we're going to talk about that shortly. So we've talked a lot about stress, and I don't want to just talk about stress, but I want to talk about resilience, because resilience is so important for our communities. It has been historically, and it will continue to be. Psychologists define resilience as the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress, such as family and relation problems, serious health problems, or workplace and financial stressors. So if you think back to those tables that I showed you regarding Hispanic stress and acculturation stress, for Latinos, resiliency is the process of adapting well to these stressors and traumas. As much as resiliency involves what we call bouncing back from these difficult experiences, resiliency can also involve profound personal growth. And I'm sure that you all are aware and you all have experienced this yourself, that you, as we've gone through this COVID-19 pandemic together, we've learned things about ourselves. We've learned about things that resources, coping skills that maybe we had forgotten about, or we've picked up new ways of coping. And really, that's what resilience is about. It's not just bouncing back from a traumatic event or from a stressor, but it's coming out of that stressor even more, more resound, more resilient, and actually having grown as a person or as a family or as a community. Um, you all have wonderful examples, I'm sure, of how your communities have stepped up to help families and individuals get through these tough times. Very innovative ways that folks have been able to comfort each other, have been able to um, um, support each other, both via these kinds of Zoom meetings and internet webinars, but also in some cases out in the community. And we're going to talk about some of those community-based coping strategies shortly. But the point being here is that resilience is a really important term for a really important concept for prevention and early intervention providers. And the idea is that not only do we want to cope with a particular situation, but we want to come out of it even better. So Frida Walsh, who is an expert in family resilience, she identified 9 key processes of family functioning that promote family resilience. And as you all know, Latinos we're very family oriented. We have very strong family values. So some of these things have come from her research, that family belief systems or meaning making is really important in terms of a resilience strategy, having a positive outlook and hope, uh, being transcendent, having some type of spirituality that can help us spiritually get through a particular stressful event, organizational processes that include flexibility to adapt. So a lot of businesses, a lot of clinics, a lot of universities have had to adapt. Connectedness and mutual support, kinship. Of course, Latinos are historically have relied heavily on our extended family support systems. That's very important in terms of building resilient families. Being able to access social, economic resources, developing communication processes, including clear information. This is so important right now during COVID-19, as we hear a lot from the Spanish-speaking community that information is not available in Spanish about what COVID is, how it's transmitted, where to get testing, how to prevent COVID. So having really clear information is important. Emotional sharing is important during these times. particularly within families, and collaborative problem solving and being proactive. So this is from the literature on family resilience. Let's go to the next slide. One of the things that we talk about in our community, and researchers and clinicians have talked a lot about, is familismo as a protective factor. So the concept of familismo or familism is a core value in the life of many Hispanics. And we talk about family loyalty, interdependence over independence, and cooperation over competition. These values may impact health outcomes, and there are a considerable number of studies that have shown that higher levels of familismo, having stronger core values towards the family, buffer the negative impacts of stress. Familismo as a value contributes to family stability and is linked to better physical health behaviors, higher likelihood of seeking medical help, better psychological health, and lower perceived burden of stress. Familismo is also associated with highly involved parenting practices and have been found to be related to fewer behavioral problems in children. Again, as I mentioned in a shout out to my colleague Danielle Santisteban, whose work focuses on building familismo among families where there is a substance abusing child. So very, very important. In one study that actually I conducted with Danielle Santisteban, we did a series of interviews with families, and we were able to identify ways that families can cope with stress. That actually families told us about how they were effective in coping with different types of cultural stress. So you can see here a listing. So for discrimination stress, families told us that it's important to maintain a strong sense of identity and self-confidence, to have a strong sense of cultural identity through cultural bonds and unifying with other people from the Latino community, religion and spirituality, that is looking towards God and religious texts to assist in emotions that arise from dealing with discrimination. We had parents and families that told us that the Bible, for example, teaches equality. And then finding resources and getting legal help, very, very important, as well as, uh, if possible, voting for measures and laws that benefit immigration causes. For marital problems and stress, families told us that, learning from others, asking advice, seeking assistance from other Latino family members or the clergy was really important. For parenting stress, our families, Latino families, told us that communicating with their children is crucial, having good communication skills, seeking help from extended family, aunts, uncles, grandparents, primos, primas, very important. Seeking professional assistance was actually mentioned by our participants. And then building consensus between parents about child rearing, very, very important. That parents need to be on the same page about how to deal with families and children. We have a couple of other examples here. Uh, what Latino families told us about dealing or coping with or being resilient for immigration stress. Again, becoming educated on topics of immigration, ESL, and gathering information and resources on American culture, maintaining hope, finding assistance through ESL and studying. Um, Again, relying on the Bible and other spiritual texts to maintain hope. For family conflicts, Latinos tell us that seeking support from other families who are not directly involved in the conflict is very important. I remember one or two participants telling us that they would talk to what they consider to be other healthy couples, other healthy parents, other Latino parents, and ask them for advice. So that's really important. We've talked about spirituality, how important that is for, for Latinos, increasing communication skills with family, and for health-related stress. Interestingly, or not interestingly, but importantly, seeking traditional remedies, treating yourself, getting advice from the pharmacist, getting help from pharmacies that have medications in other countries, or even going down to Mexico. Finding local clinics and low-income assistance clinics, relying on family for emotional support, monetary support, and developing healthier habits in general to prevent health problems. So again, this is just kind of a summary of one, and there are many studies like this, but this one we wanted to focus on building resilience in families and to hear what families are actually doing in the Latino community to kind of promote health and behavioral balance. So we wanted to, as referenced in the title of the presentation, we wanted to also talk about holiday stress. And again, um, for providers, for those of you that are providing services in the community or running clinics or running prevention specialty units, obviously holiday stress can affect anyone. There are many expectations around the holidays. Many people associate the holidays with social gatherings, rituals, and happy memories. These expectations can also lead to stress. When we talk about holiday stress, we have to recognize also that we're not just talking about Christian based, but also the Jewish faith and other faiths that are practiced here in the US. So to make sure that we understand that we're thinking about the holidays as a period of time that's being celebrated by many different religions and cultures. Obviously, COVID-related stress has added to the holiday stress that many of us already feel. Things that can bring more stress to our community, more financial stress. Obviously, as I said earlier, a lot of our people have lost their work. They have under a great deal of financial stress. There is limited domestic or international travel. So many of our familias that would go back and forth to visit familia in other countries, that's very limited, if not prohibited in some cases. Loneliness and isolation, no contact with extended family. We all have stories of elderly uh, abuelitos, grandparents, grandfathers, grandmothers that are still isolated in nursing facilities, care facilities where we really can't visit them. So this is really hard for all of us during the holidays. Canceled events like Las Posadas and other cultural traditions that have had to be canceled, it leaves a big gap, a void for all of us. Um, no traditional worship or faith-based holiday activities or events that would usually take place. Limited gatherings with families and friends, and depending on which city or which area you live in, some communities are basically saying cancel everything. So gatherings have been greatly limited. And yet there's still high expectations to give gifts, host meals, and things of that nature. Um, so these are the kinds of things that affect the general population, but I think especially affect our population. Next slide. What are some of the consequences of holiday stress, again, due to COVID? And as I mentioned earlier, I'll just repeat it again. We're looking at the cumulative effect of acculturation related stress and COVID-19. And so we know that that's leading to high levels of anxiety, depression. I mentioned social isolation. Substance use rates have gone way up. Alcohol use, I don't have that in here, but that has gone up particularly high. Um, Kids often express some of these issues in physical symptoms of stress, headaches, shortness of breath. We saw the data there on the increased emergency room visits. Some of your communities are having really high rates now of domestic violence. We're seeing a lot more of that. Relapse in persons who previously have been in recovery or are in recovery. We have a lot of people that have really high levels of fear and anxiety about contracting the COVID-19. And some people that may feel guilty about not being able to provide, the kinds of presents they would have liked to have given, or the vacations that they can't take, the travel to meet with families. So there may be a lot of guilt that people experience as well. All of these are very important as service providers to understand that during this, 1 month, a month and a half period are going to affect our families considerably. So these are just some tips for providers, right, to prevent holiday stress. And these are both for self-care. I know as providers, many of you have gone far and beyond the call of duty to help your clients and to help communities and families. And sometimes, that can exhaust us as well. So we need to be mindful of that and take care of ourselves by acknowledging your feelings, right? And talking to other people, reaching out if you feel lonely or isolated, seek out community, religious, or other social events. Be realistic, especially during the holidays, that the holidays don't have to be perfect. I mean, you don't need the, necessarily a big production, maybe that you've always, or that you've done in the past. So the holidays don't have to be perfect. Plan ahead, set aside specific days for shopping, baking, and other activities. This is really important for kids that they have a schedule, very important, especially if they have time off from school and yet at the same time, they're not able to do the kinds of things they did um, um, during previous vacation periods. So having a schedule for the youth and for families is important. Attending virtual church services and other spiritual or places of worship is very important. Practicing self-care, make sure you're getting enough sleep. Exercise, we can all still do that. We can all still try to eat well and set aside some time for yourself if possible. Practice mindfulness, keep your attention on the present and not necessarily on the past or the future. And learn to say no. Saying yes when you should say no can leave you feeling overwhelmed, even during these vacation periods. So um, we all need to try to slow down a little bit, especially to have some schedules for ourselves. Make sure that we're taking good care of ourselves. Just some other tips to help our clients get through this period of time, especially for Latino clients. Reaffirming our clients' cultural identities. This is very important. Um, some of these, by the way, I wanted to mention that Project Youth in Orange County, the Orange County Bar Foundation, is an organization that we've been partnered with for a long time, and they have done such a great job in the city of Santa Ana and in other high density Latino communities. So a lot of these tips, I told them I would shout out to them. So they were helpful in helping me think through this slide. But reaffirming our clients' cultural identities, encouraging cultural celebrations, having direct contact, that is phone contact or internet with clients, both past and present, just to check in with them, identify what their needs are. Um, I know in the case of Project Youth, they provide families with gift cards for the most needy families. But that requires that you do that checking in with them and going back to the clients or the families that have gone through your clinic or agency. And even though they may not be a current family or current client, but just reaching back to them, checking in with them to see how they're doing. Identifying and providing information for community food pantries, really important for our families that are suffering right now financially, that they have at least have a good solid meal and nutrition during this holiday period. Um, Offer virtual stress related exercises that can be done on the internet or through webinars. Encourage virtual church services. We had mentioned that before, that we encourage people to attend their local worship. Increasing clients' appointment times. So if you have clients that are in great need, rather than seeing them every couple of weeks, or if they're in a group setting and you want to reach out to them individually, trying to increase your client appointment times. And explore low risk holiday themed events. I know where I live, there are a lot of drive through. We're in Southern California. There are many drive through activities and events available for parents to drive their kids through and to entertain them with music and other light shows and that sort of thing. Uh, if you can partner, if your organization can partner with local grocers to help with food giveaways, having food drives, especially for needy families, having a COVID fact sheet available in Spanish is very important. For youth who are out of school, making sure to find ways to provide student lunches, that's going to be really important now. Well, it's been very important through COVID-19, but now that students are even on break, even more important. Toy drives with partner agencies, Toys for Tots, Festival for Children. And again, I'd like to thank the staff at the Project Youth from the Orange County Bar Foundation for helping me work on these last slides. Next slide, please. I'm not going to go through these in any detail because I want to be mindful of the Q&A time, as we're close to my time limit here. But again, these are just kind of a reminder. Be aware of the cultural stressors that we've talked about here earlier in this presentation, both chronic and recent stressors. Try to help folks use reframing of those things. Improve your planning, help your families improve their planning, especially important for families with young children to have a schedule if possible. Learn relaxation. There are many, many studies that have shown an important link between relaxation and health. Relaxation exercises include progressive muscle relaxation, deep breathing, guided imagery, for some people, clinical hypnosis and biofeedback. And affirm your values. Research has shown us that those people who think about their highest values or skills before a stressful event actually experience less stress and show a substantial decrease in the stress hormone cortisol. So planning, knowing when you're coming into a stressful situation, affirming your values, knowing what your strengths are, all of those things are important. Many of us have signature strengths, things that that you're really good at. Try to call on those things, mobilize those things within yourself, within your families, and for your clients, those of you that are providing services. Mobilize those resiliency factors that we talked about. Get people thinking about coping through the holidays and what they can do in a positive way. Develop a forgiving style, right? Forgiveness has been shown to have a powerful buffering effect on stress. So maybe now's the time to shout out to a neighbor or somebody that you've had some conflict with, and develop that forgiving style. Practice mindfulness. A lot of research on mindfulness, and for sure, for those of you that are not familiar with mindfulness techniques, I strongly urge you to do a quick Google search on mindfulness techniques. Unleash your gratitude. This has been, again, very, very important uh, that we practice spiritual gratitude, count our daily blessings. This also has a big impact on reducing our stress. And then finally, using positive self or family affirmations so that, again, what we're trying to do, or what I recommend, is that we try to promote and pull on our and mobilize our stress resilience, mobilize our coping, and do that not only for ourselves but also in our work, in our prevention work and early intervention work with our familias and our individual clients. With that said, I believe if there's I think this is our last slide. So I wanted to thank you all. Here's some additional resources for you all to go on. We are going to provide a fact sheet for you regarding Hispanic stress during the resilience. And I believe after the webinar, you'll be directed to a different page to complete our evaluation as well. That's really important because evaluation is the way that we can document that we're doing our work. So again, on behalf of the National Hispanic Latino ATTC PTTC, thank you for inviting me. Now we're going to go into questions. Any questions and answers, I'll turn it back over to the PTTC staff. Thank you.
Dr. Cervantes, thank you so much for this wonderful presentation. I think it's so relevant. I love all the comments in the Q&A and in the chat. So thank you so much, Dr. Cervantes, for also reminding us the importance about the complete evaluation at the end, but and also to remind about our culture, how important it is to manage those stressful times. So thank you. We have a few questions, Dr. Cervantes, in the Q&A, and thank you again, everyone, for helping us with this, all the beautiful comments and questions that we have. Let's start with Jose Luis Vasquez Martinez. He is asking, what do you think about singing carols and posadas as long people do as outdoors?
Well, Jose Luis, I think that's a great idea. And as long as you can practice the CDC recommended safety protocols for your community and your local community protocols, I think that's going to be up to you. But social distancing, masks, hand washing, very important. I know it's kind of hard to sing through a mask, so those are some of the things that you probably want to take a look at, again, the CDC recommendations, as well as your local city or county guidance on staying safe.
Well, and also we have a question from Nasli Restrepo. We say, thank you, Dr. C. We are so grateful for all your support and sharing this information for all of us to continue to serve our community the best way possible. This is from Project Youth OCVF. So thank you, Nasli. And the next question is from Jose Luis Vasquez. He's asking which telehealth services you recommend for providing counseling and care in Spanish.
I'm not sure where you're located, but I would first start with your local, in your local area, either your city, county, or state behavioral health department to see what they have available in Spanish. Otherwise, that may be something that I'm sure the PTTC can recommend some online Spanish intervention or prevention programs for you. If I understand the question correctly, I know that a lot of people are making adaptations to their early prevention and their intervention programs. to put those online. We all know that there are very few, unfortunately, very few Hispanic-based programs. I can certainly recommend that you check out the the website, or if you Google in CIFFTA, that's Culturally Informed Flexible Family Therapy for Adolescents. That will take you to some information about that particular treatment program. I'm not sure if they have that now up and available online. Familias Unidas is another program that I believe they have an online program available. That's being run out of the University of Miami as well. And Familia Adelante, another drug prevention program, is available in an online platform. But there may be others. I recommend that you check with your local, again, city, state, and county behavioral health department to see what's available locally.
Thank you. Thank you, Dr. Cervantes. And we have a question from Julio Briones. He said, specific to Latino speaking news services, has the CDC consulted with them to best provide information to Hispanic and Latino, Latina, Latinx groups?
That question I'm not qualified to answer. I do know that the National Hispanic and Latino Behavioral, or the National Latino Behavioral Health Association, now is partnering with Morehouse University on a national effort to communicate and inform communities of color regarding COVID-19. So if you look at Morehouse University, or check the NALBA, the National Latino Behavioral Health, the National Latino Behavioral Health Association website, you may find more information there about community involvement and community participatory decision-making regarding COVID-19 responses.
Thank you, Dr. Cervantes. And Jessica Cruz is asking, what are some tips when talking to children about why we cannot have large gatherings for the holidays?
And that's a really good question. And a lot of our familias are confronted with this. And depending on your child's age, we want to be able to communicate with them about the health facts about COVID-19, that it is a highly infectious health disease problem, virus, that we all need to protect ourselves from the virus right now. And that the ways to do that are to stay safe at home if possible. Again, as I mentioned earlier about children and having a schedule for them, trying to make sure that you include in their schedule things that they can do safely, both in the home and then outside. Again, some of you live in very cold places. Others live in warm places. So depending on what region of the country you live in, you may or may not be able to do a lot of things outside. Obviously, outside activities as a way of rewarding our children is really important, as well as doing any other kinds of things that might be rewarding for them. Special prizes, special gifts, and also just praise. When your children comply or help you and your family comply with the COVID-19 guidelines, to praise them. I recently saw this is some prevention resource materials on, I think it was called 101 Ways to Praise Your Child, and that's also available in Spanish. So you may want to Google and find that resource. But the other thing is to give children hope. Really important to let them know that the scientists are working on a vaccine, and the vaccine should be available. We're all hoping that it's available soon, if not, early next year, and to make sure that your children are hopeful about that, and that one day they will be able to go back out and do their regular activities, go back to school and that sort of thing. So instilling hope in children is really important.
Thank you, Dr. Cervantes. See in the chat, we have a lot of people. Thank you for thanking you for this wonderful presentation and for sharing all the resources. So thank you so much. We want to remind also of all the participants that NALBA, the National Latino Behavioral Health Association, is currently developing the web page for COVID resources. So keep the eyes open and join the Juntos networks. Once this information is available, you can access. So we have a few more questions. Angie Espinosa is asking, how do you explain mindfulness to monolingual Latino, Latina, Latinx community?
I think that's a great question. And in some ways, mindfulness is about, quieting ourselves. It's very similar to for those of you that have done any kind of prayer activity. So mindfulness is a way of quieting ourselves, to trying to center ourselves, and trying to focus on a particular problem or issue that we want to resolve. And so it's, I guess the best way to explain it to monolingual Spanish speaking would be that mindfulness is sort of like it's a form of, it's kind of like a form of quieting ourselves and praying.
Thank you, Dr. Cervantes. Thank you. Okay, I think we have one more question or comments over here. Say thank you for the information. This is very helpful as we are facing so many problems with this pandemic. So, and let me see one more question if we have time for one more. Jose Luis Vasquez is asking, are you aware of any opportunities for coordinating care services for Hispanic population with services providers in the country of the America, like telepsychology services provided in Mexico via video conference? Stogie asking about telemedicine in the Latino countries.
And that I'm not as familiar with. I'm not as familiar with what's going on in some of the Latin American countries around telehealth at this point. But again, you might want to send that. It might be something that I can respond to. If you send me that comment, I can respond and do a little research and respond to that, Dolca.
Yes, thank you. And it's a good idea to check with your local consulate to see what they have available. So thank you, Dr. Cervantes. Thank you so much for helping us to address this amazing topic. Thank you for reminding us that as a prevention specialist, we play a role and we can make a difference in our communities, especially those uncertain times. And thank you so much for giving us hope to look the future with hope and make sure that we take care of elders and our families. So thank you, Dr. Cervantes. We appreciate that. Now it is time here for next slide, please. Over here we have some our contact information. So this is the National Hispanic and Latino Prevention Technology Transfer Center. So we have our director, myself, and Priscilla Yamasi contact information. So feel free to reach us in case you have any questions. Maybe we didn't have time to answer all the questions live. We want to make sure that we address them in via email. Also, here is Dr. Cervantes' contact information. You can contact him at any time. And please, now everybody will be redirected to a different page to complete the evaluation. Please remember that your opinion is important to us. Thank you for joining us during our webinar titled is Hispanic Stress and Resilience during the holidays. Enjoy the rest of your day. Thank you.